Seasonal depression affects nearly 5% of the nation annually.
And here to talk to us more about the symptoms and how to treat them is psychiatrist Dr. Stephen Levine. Good morning.
Good morning. Thank you for having me here in this warm studio. It's cold out there.
It's cold out.
It's freezing.
And, you know, we're talking about seasonal depression and then the depression that we're more familiar with. What's the difference?
The symptoms are fairly similar, but this peaks during the late fall to early spring months.
Seasonal depression, people don't realize that. The seasonal depression does.
It does. So it's a fairly long period of time, and it corresponds to the days during the year where there's less sunlight, the shorter, darker days.
Okay, so some people would think that this was the time that it affects the most people, seasonal depression, but it's actually...
Seasonal depression is most common during this time, but depression generally actually peaks during the summer, which surprises a lot of people.
Okay, I understand.
What are some of the symptoms of seasonal depression?
Sadness that doesn't go away. Everybody has a bad day and gets bummed out, right? But this is sadness that lasts for at least 2 weeks consistently, oftentimes for much longer. Thoughts of suicide, social isolation, changes in sleep patterns, changes in appetite, weight gain or weight loss, feelings of intense guilt.
And so that's the ones for depression, not seasonal depression, right?
Those really fit in both categories, actually. Yeah.
So when should you see somebody? When should you take note and go and seek help? When is that necessary?
Yeah, people should start off with preventative measures. There are things that you can do that may make it less likely to develop seasonal depression. Those are things like healthy sleep habits, light therapy, self-care. So those are 3 big categories. So going back through healthy sleep habits, having regular sleep routines, avoiding bright lights around the time of sleep, especially big screens, smartphones, things like that. And then self-care being things like healthy eating habits, minimizing alcohol intake, getting outside and taking a walk each day, resisting that impulse to stay inside and hibernate when it's so cold and dark out and actually be around people. You know, we're social creatures. It helps to be around people. And then there's light therapy. There's not enough natural sunlight during the day, but you can use artificial light boxes each morning. Some people call them their happy lights. And you set it up and you use it for about 20 minutes each morning, and it can simulate sunlight. But for some people, that's not going to be enough. And if these symptoms aren't improving, if they're lasting, if they're starting to impact your social functioning, your work functioning, then it's time to raise your hand and see a professional.
When should you know if you need to take medication for depression?
Most people would start with talk therapy. And if you're not seeing improvements pretty quickly, or if you're having really severe symptoms like suicidal thoughts, then medications would probably be appropriate. And those are things like antidepressants, the ones that have been around for a number of years. And then also through my practice, Actify Neurotherapies, I've pioneered the clinical use of a medicine called ketamine, which can be given in low doses intravenously. We have offices around the country, including here in Manhattan. And this is a medicine that can be taken much less often and can work much, much more quickly.
Some people know that as a street drug too, right?
It has a reputation as a club drug, but it actually has been around since 1962 as a general anesthetic, so used during surgery, also used for pain. It's one of the most widely used, most commonly used medicines around the world. It's on the World Health Organization's list of most essential medicines. And so this is a new use of a pretty old and well-known and very safe medicine.
Speaking about depression, sometimes you get to the person who's depressed too late. You know, so what are some of the symptoms people should look for, and what can people around someone who's getting depressed do?
One of the big signs is a big change in daily habits. And so the person who's always shown up for work or always attends at a family event, all of a sudden you aren't seeing them, that's a bad sign. Right? Social isolation is a big, big warning sign for people with depression, with anxiety. It's a tendency that people have, unfortunately, when they could use that support most. Right? You need that support network. You need the people around you during those times most. But the tendency is, one of the cardinal symptoms is actually to pull away from it. And so if you're seeing that in a loved one, that's a red flag.
And especially for seasonal depression this time of year, clinical depression all year round, but especially, like you said, in August and the fall.
Exactly.
We got it. Doctor, thank you so much. We appreciate you coming in.
Thank you for having me.
We'll be right back.